Are you a man above 50 years of age? Do you have to frequently get up in the night to pass urine? Is your urinary stream weak? Do you have to make frequent trips to the bathroom? Is it that you can't control your urination? You have to rush to the toilet even if you are in a public place or wherever. It becomes difficult to stop urination. Or do you have any other symptoms like burning sensation in the urine? Beware. These could be signs of some serious underlying problems with your prostate. Hi, I'm Dr. Vivek Maste. I'm a urologist practicing since 25 years in private practice. And today I want to talk to you about prostate. So this video is primarily intended for males, but if you are a woman watching this video, then yes, you can also be involved in encouraging the men in your life to take care of their prostate health. Now, why are we talking about prostate? Every male has this organ called prostate, which lies beneath your urinary bladder and is an integral part of the accessory reproductive system in the male. Once a man crosses the age of 50, this prostate can enlarge and give rise to difficulties in passing urine. Some of the symptoms of this benign enlargement, today we are talking only of benign enlargement of prostate. There are other diseases which we'll cover in the next video. But for now, today I'm talking only about the benign enlargement of prostate. This typically occurs after the age of 50 and will cause certain symptoms such as slow stream, where the urinary stream is no longer as forceful as it was before. You may have to apply pressure or strain to pass urine. You may have to frequently take trips to the bathroom to empty your bladder. And there are often times where there is a distinct feeling of urgency, where if you're traveling in a bus or in a train or even in a car, you feel this need to get down, stop your journey so that you can find a place to pass urine. The other late symptoms could also include blood in the urine or infections giving rise to a burning sensation or even fever. Now, why this happens is once a man crosses the age of 50, there are certain hormonal changes which are happening in the human body, and these can adversely affect the prostate gland, which can start enlarging. It becomes bigger in size, and since this gland is surrounding the urethra at the base of the bladder, as it grows inwards and outwards both, it will compress the urethra and cause an obstruction, giving rise to the symptoms which I mentioned. Ignoring these symptoms could lead to further complications. A patient may suffer from retention of urine, meaning the urine stops completely and there is an emergency need to travel to the hospital to get the urine drained out. It can give rise to infection, as I mentioned before, that is also a complication. Very late sequelae of this kind of a problem could also result in a pressure on your kidneys and causing a surgical renal failure. And in some cases, a person may form bladder stones because the urine remains stored in the bladder for such a long time. So therefore, these complications even can necessitate surgery in the future. So if one is aware of these things, then proactively, after the age of 50, you can seek a urological consultation in order to assess your prostate health. There are other aspects of prostate health like prostate cancer for which certain screening tests like blood tests are available, and these ideally should be done once a year after the age of 50 for every male. And in addition, if you have any symptoms, then please do not ignore because they could be the beginning of a prostate problem, which in the future you could land up with surgery. Fortunately, today a lot of good medications are available which can definitely relieve the symptoms of a benign enlargement of prostate, but an early detection of this condition is mandatory. So if you ignore the symptoms for too long, then you might reach a stage where these medicines will no longer be effective for you and you may have to face surgery. So this video was created in order to create this awareness amongst men above 50 that if you have any urinary symptoms like the ones I mentioned, please consult a urologist near you and make sure that your prostate is assessed, all the necessary tests, investigation, and consultation is done and you remain in good health. If there are any problems already existing, then you get treated for it early enough so that you may start medications and avoid surgery. Or if you are even late, then surgery is a good option sometimes, and it will relieve you of your symptoms and prevent further complications like kidney failure. So this was the short video created for this purpose. I hope you enjoyed it, and feel free to consult your urologist for any further information. Thank you.